Okay, so before we start, what I believe is most important for a candidate who is preparing for NCLEX exam is to know about the strategies. Strategies that are necessary to, solve a multiple choice question or any question in NCLEX exam. Because if you are equipped with the skills and strategies that are required to pass the exam, then you will feel confident. And even if you don't have knowledge about some of the questions, you will be able to tackle those questions in a better way, rather than just doing the things in haphazard fashion. You need to learn and practice those strategies. So let me share my screen here. Uh, all right. So can you see my screen?
Yes.
All right.
Yes,
So,
sir.
in today's session, we are quickly going to review some of the strategies that I believe are really useful. And by learning and practicing those strategies, you can, ace the NCLEX in a better way. So, our topic for today's discussion is how we need to approach questions in NCLEX exam. There are some conventional strategies that most of us, have used in our previous years. I don't know about you guys, but I thought, sometimes in my life, like about all these conventional ways. These are different ways, and I'm going to show you here what are those conventional ways. So the first thing is, if you don't know about the answer, like in my experience, what we used to do, what we used to do is like, if we don't know about the answer, we thought like the longest option is the correct, so we picked that one, right? If we were not aware what is the right answer, we assume like ਜਿਹੜਾ ਲੰਬਾ ਆਨਸਰ ਹੈ ਉਹਨੂੰ ਪਿਕ ਕਰ ਲਓ, right? So that's not the right way. The other conventional thing or traditional kind of, like, people have made some kind of strategies, like the words any, many, miny, mo. So these are the things, like if you don't know the answer, just use this trick. The other thing is, if you are in doubt, the answer is C. So you don't know the answer of the question, and you will continue picking the right option, C, as the correct one. And then if you don't know, some people will use none of the above or all of the above as the correct option for their question. So these are all the conventional ways to attempt questions which are not the right ways, right? You need to avoid these things. You need to focus on the question, and you need to try to understand what the question is demanding, and then you need to attempt that. In case if you don't, I will take all your questions at the end of the session. Pansy, just keep your questions with you, and we will discuss those. In case you don't know answer, try to apply a guess, like an informed guess. What I used for this is an informed guess. And what is an informed guess? An informed guess is like, it is a guess that is coming from your experience, right? And most likely you are going to be right if you are applying an informed guess in your questions. So what are the right techniques, and what I advocate for? Uh, so the very first thing is, you need to read the question carefully. What is reading the question carefully? You need to find the keywords in the question and try to highlight those keywords. Say, for example, here I can use the highlighter here. what are the keywords here in this question? For me, uh, the question is related to heart failure. So heart failure is a keyword here, right?
Hmm.
And then let me just read the question completely. A nurse is caring for a patient with heart failure who has been prescribed furosemide, which is LASIK. Which of the following assessment findings would require immediate intervention? So the other keyword here is LASIX.
6.
Yeah, and what else is like assessment findings? So here
Hmm.
we can have an idea that the question is related to assessment. So our
Hmm.
answer would be related to that. So all
Hmm.
these are the keywords. So we need to read these keywords carefully, right?
Hmm.
So what could be the right answer here? Uh, Based on reading the question carefully, I can say if you need to have the knowledge regarding heart failure, right? So, heart failure is a condition when the heart is not capable to meet the body's oxygen demand, like the
Hmm.
pumping ability of the heart is compromised. Say, for example, heart is doing like, just like
Hmm.
this. Uh, Instead, the heart need to contract forcefully to eject the blood in the systemic circulation. So if the heart will not contract forcefully, what is going to happen? Uh, the blood is going to stay in the pulmonary circulation as well as in the peripheries. So let's try this MCQ. So here the question is related to the assessment, and you need to have the knowledge about heart failure as well as for the furosemide. Like one of the complication is what is the complication of the furosemide medication?
This करता है ये, और जो हमारे भी जितने भी इलेक्ट्रोलाइट्स इम्बैलेंसेस होंगे फ्रूसामाइड्स की वजह से, इलेक्ट्रोलाइट इम्बैलेंस की
Exactly.
वजह से फिर हमारा जो ऑप्शन सेकंड जो है वो इससे रिलेट कर रहा है, क्योंकि फ्रूसामाइड जो है वो इलेक्ट्रोलाइट बैलेंस करेगा यूराइट के करने की वजह से। तो पोटेशियम लेवल 2.8 मिलीग्राम इज द इमीडिएट इंटरवेंशन।
Exactly. This is the thing that you need to treat, right? So potassium here जो है वो आपके पास जो है वो right answer है। Why? Because potassium के levels जो हैं वो lower हैं. So one of the complication or you can say side effect of furosemide medication is कि ये हाइपोकैलीमिया कराता है। ठीक है, तो इसको हमें ट्रीट करने की ज़रूरत है। अगर पेशेंट जो है वो हाइपोकैलीमिया में रहेगा तो उसको arrhythmias के chances हैं. So this is the immediate intervention. You can see rest of the option like the blood pressure
इज द नॉर्मल
110 by 70 is normal. We don't need to
नॉर्मल
do anything with this, right? Mild peripheral edema,
इज
we can
माइल्ड
expect
नॉर्मल।
this, right? The mild one is okay. Why? Because it's heart failure, and this is normal thing. And then urine output 50 ml per hour, absolutely normal, right?
नॉर्मल।
Absolutely normal. So this is how you need to approach the question, how you need to read the question carefully. Try to understand the keywords, highlight those keywords, and then try to find the right option. Okay. So the next strategy is cover up strategy, right? You need to cover the responses and then try to find the answers based on your knowledge. Say, for example, here is a question. Let me read the question for you folks. A patient admitted with acute myocardial infarction (MI) suddenly develops crackles in the lungs, dyspnea, and pink frothy sputum. Which intervention should the nurse perform here? So again, we need to find the keywords in the question. Hashim, can you please tell me a few of the keywords here?
ओके सर। ये तो मेरे ख्याल में ये जो मायोकार्डियल इंफार्क्शन एमआई होता है हमारे
Okay, you just need to tell me the keywords. You don't need to explain it. So the first one is myocardial infarction is the keyword. What else?
आई डोंट नो सर, सॉरी।
Okay, no problem. So the other thing is like Pansy?
Crackles. Yes.
Yeah, it is
The first
crackles in
you
the
told,
lung.
and second the crackles in the lungs, dyspnea, and pink frothy sputum.
Yeah, and the
And the
dyspnea and the
yeah,
ping for the
frothy sputum.
yes.
And the other line is the keyword is intervention. Which intervention should the nurse
Yes,
perform first?
exactly.
First is the most important.
Yeah, so you need to remember here what is the priority action, right? Which
Yes.
intervention you need to do first. So, MI हुआ हुआ है, crackles हैं, dyspnea है, pink frothy sputum आ रहा है. So all these are the symptoms of what?
Infusion. Pulmonary infusion.
Pulmonary edema.
Yeah.
Pulmonary edema. So all these are the symptoms of pulmonary edema. So मेरे पास अभी यहाँ पे जो है वो I don't have the option. So I have covered the options, and now I am trying to find the intervention. Like what should I do? So what I need to do? Like do I need to give oxygen to patient? Do I need to administer furosemide to patient? Do I need to raise the bedside of the patient to 90 degree, or do I need to do an other intervention? So what do you think? What should be the priority here? What
सर
should be
इसमें
the first
ऑक्सीजन
intervention?
सर ऑक्सीजन भी लगा सकते हैं, और मेरे ख्याल में लेसिक्स भी जो फिसोमाइड है वो भी दे सकते हैं।
Okay. What about you, Pansy?
First action should be the bedside should be 90 degrees
Exactly,
centigrade.
exactly. Because the other things will take time. So the very first thing
Yes.
is you need to raise the head
90
side
degrees
of the
centigrade.
bed to
Yes.
90 degree.
90
Okay.
degrees centigrade.
So that's okay, Hashim. This is the first session and we are learning. I know you
ओके
will
सर।
find you will feel absolutely okay after 2 to 3 months. You will say I am okay, right?
ओके सर।
So here you can see like these are the options in the question. Administer furosemide. Yes, we need to administer, but this is not the priority because it will take approximately 10-15 minutes to start its action to achieve a therapeutic action. It will take some time. So place the patient in a high forwards position. Yes, this is the correct option. This is the first intervention that we need to do. Prepare for intubation in mechanical ventilation. No,
Later on. Hmm.
but here we don't need to even think about it because the patient is in dyspnea, but we don't know further about like whether he is in severe condition or he can't or he or she can't breathe or having too much difficulty in breathing that requires intubation, and then notify the healthcare provider immediately, right? So this is how you need to apply all these strategies. So let's proceed. The other strategy that we need to learn is elimination strategy. And for me, this is the most important strategy. Okay, this is the most important strategy that we need to learn and practice, right? We do not need to try to find the right answers, rather than we need to learn how we can eliminate the options in the question. So here the example is a nurse is monitoring a patient who had a percutaneous coronary intervention PCA with stent placement. Which of the following findings requires
Immediate,
immediate
immediate
intervention?
intervention.
So the first is mild discomfort at the catheter insertion site, blood pressure
No.
130/80,
No.
decreased pedal pulses in the affected
Yes.
leg, urine output of
Mm.
40 ml per hour. So let's
No.
read the question for first and highlight the keywords. Nurse is monitoring a patient who had what is
Percutaneous. Can I
PCA.
read, sir?
Yeah, PCA.
Okay.
The patient is with PCA. So, stent placement, like after PCA, there is a stent inside the coronary arteries. And findings, which of the following findings? Immediate intervention, right? So these are the keywords.
Mm.
The first thing is mild discomfort at the catheter site. So this is expected. Like we can expect that there could be mild,
Mm.
discomfort. So we are going to eliminate. We are putting a big
Yes.
cross here. We don't need this answer.
Yes.
This is not the right answer. The second thing is blood pressure of 130 by 80 millimeter of HA. Hashim, what do you think? Is this blood pressure normal, or this is something serious?
सर ये सीरियस भी हो सकता है, ये ब्लड प्रेशर 130/85।
Mm-hmm.
तो मेरे ख्याल में सर जो इसकी जो हमारी थर्ड नंबर पे जो क्वेश्चन है, डिक्रीज पीडियल पल्स इन द अफेक्टेड लेग्स, इस ये आंसर मुझे लग रहा है ये।
Okay, but my question was, is this a serious thing? Is this blood pressure is a
यस सर,
serious thing?
यस सर, सीरियस थिंग, यस सर।
How do you think this is serious? Why we need to give
सर पेशेंट
priority to this one?
सर पेशेंट की पीसीआई हुई है, तो जिसकी वजह से इसके बीपी मॉनिटरिंग करना बहुत ज़रूरी है, और ये नॉर्मल से थोड़ा सा रेज है इस वजह से।
Okay, but do you think, Pansy, this requires here is the key word, Hashim, in the question. Which of the following findings requires immediate intervention? Do you think this blood pressure requires the most, priority, or we need to prioritize this intervention over the other three? Hashim, you are away. So that's
यस सर।
okay. Yeah. So do you think this is, we need to prioritize this answer over the other things?
अदर थिंग सर, सर अभी इतना नहीं है, तो मैं काफी।
No, we don't need to prioritize this over others. As you said, the right answer is decreased pedal pulses. So this is the thing. This is alarming sign, right? If you
ओके।
feel that the pedal pulse is not there, and the coronary intervention procedure is done through femoral artery, so this can indicate there could be dissection of the artery, there is improper circulation, there is hematoma formation, this can be anything. So that's why this requires immediate intervention. Rest of the options, like the blood pressure is okay. This is not that high, which requires immediate intervention. Urine output of 40 ml per hour is pretty fine. We don't need to do anything with this. So what's the right option?
Three. Three.
Yeah, C is, or the third one is the right option, and this option requires, you know, immediate intervention. So this is how we need to learn and practice elimination technique. If you will apply elimination technique, your passing probability will increase. For example, here we have four options. If we don't apply elimination technique, our passing probability is 25%. Like if we select one right answer out of the four, our passing probability is 25%. If we eliminate first option, our passing probability will increase from 25% to 33.3%. If we eliminate the first two options, our passing probability increase from 33% to uh, 50%, right? So this is how elimination techniques helps you. And remember, in a question, there will be at least two options that you can easily eliminate. So even if you don't know the answer, try to apply the informed guess to eliminate the incorrect options or incorrect uh, responses in the question, so that you can find the right answer. All right.
ओके सर।
So these are the reference that I would like to acknowledge, the University of Toronto, Mississauga, and I took this information from their side. So I really want to acknowledge here them. There are other strategies as well, like you need to manage your time according to the exam. You need to know the structure of the exam, how many questions are there, how much time you have to attempt the exam, and then uh, the other things like how to approach, like what are the different types of questions that you are supposed to have in the exam. So all these things, all this information is critical for you to know. So before you start your preparation, try to learn these techniques and then try to apply. Even if you know the answer, like in the question in the elimination technique, you were pretty sure that this is the right answer, but I would encourage you not to right away go to the right answer, right? Just try to eliminate the incorrect options and then go to the right option. All
बिल्कुल
right, so
सही
this was all about some of the techniques that I believe are really important to learn, and I hope you'll find these techniques really helpful when you will apply these in your practice. I think they are going to really help you. So now, here is the time for our questions. Do you have any questions related to these techniques, or any other questions that you think we can discuss here?
Yes, brother. As the first first slide you show us, the conventional ways to attempt the questions. There is, I have some confusion.
Mm-hmm.
Yeah, you told us that these strategy we should not follow that.
Yeah,
Am I right?
yeah.
Okay, but sometimes all of the above questions, the stat are like that. I told before you that like that. There is a 4 and 5, and but sometimes I considered all the scenario. Sorry, all the stamps are the correct, and I attempt my questions. It is always like good, but as you said, as we people always do mistake. This is all of the above and tick. This you are right. It is happened with me. The question I attempt, I considered. Oh yes, all the when I attempt questions with all of above, it is always right. But once to two times, I think in my mind. Okay, the last question I attempt like that, and when I attempt, it was wrong. And thank you for this. Now I will never choose these strategies. I will change my mind and thoughts and conventional ways to attempt the questions.
Oh, that's great. That's great. And remember, none of the above or all of the above can be a right option, but it's not like you never need to choose this. If this is the right option in your question, you need to choose it. But uh, why I was explaining, because if we are not aware, we will think, okay, I don't know, probably the right answer is none of the above. So let's go with this one. Oh, yeah, I don't know, might be the right answer is all of the above. Let's go with this. So don't do that. If you are sure, like this is the right answer, choose it. If you are not sure, don't use these conventional or traditional kind of ways to attempt the questions, right? Try to apply informed guess in situations where you don't know. And by applying the elimination technique, you will be able to have your answers correct, most of the times, right? Because you can easily eliminate two techniques and then you can find one right answer out of the two remaining options. Okay, any other questions? Hashim, do you
भाई
have
वो
any questions?
नो सर अभी नहीं है फिलहाल तो बाकी
Okay,
सर जैसे जैसे
any questions
करेंगे जैसे
related to today's session? Otherwise, I'm going to stop the
I
recording
have
here.
one question more, brother. The time strategies, can you please explain to us?
Uh, which one?
Time strategies, questions, how
Okay,
we can.
okay. Oh, yeah. I mean, say for example, in NCLEX, is if you have 250 minutes, and if you need to attempt 250 minutes and you need to attempt 150 questions, so you will probably have 1.5 minute per question, or like 1.6 minutes. You can divide the time based on the question. So try to attempt a question in that particular given time. Say, for example, maybe you need to try to answer a question in 1.2 minutes if you have 1.5 minutes for the question, so that you can have adequate time, and you should not be short of time to attempting all those questions. So all these things will come with practice, right? When you will practice like on a regular basis, you will have much expertise, you will have more skills, you will have more techniques to apply those, and finish your exam in right time. Okay, yeah. So thank you so much. I'm going to stop the recording here. Those who are watching this video on my YouTube channel, I hope you will like the video. If you have any kind of questions or comments or concerns, please write your questions in comment box, and I'll try to answer those questions. And I hope this is gonna help you. These are the killer kind of strategies you need to think about and you need to practice. Yeah, so thank you.
Thank you, brother. God bless you.
ओके थैंक यू सर अच्छा
Uh,
सर एक और क्वेश्चन
yeah,
क्वेश्चन था
just
मेरा
give me 1 second, please. I'm going to stop the recording here.
ओके